I'm on my way to my chronic disease course. It's a course for persons with chronic health conditions, and it's sponsored by the Health Authority, supported by the Ministry of Health, and it's free. I heard about it 2 years ago. My doctor told me about it. A friend took it and encouraged me to take it as well. I called the toll-free line, and they had it in several locations. This one is convenient for me. It's 2.5 hours once a week, and for 6 weeks in a row. Now I'm finding out how I can manage my own health.
Welcome back, everybody. I hope you had a great week this week. We're going to start off, as we always do, by doing the feedback on our action plan that we made last week. And I'll start by talking about my action plan. I was going to go swimming in the afternoon. So the what was swimming, how much 3 times, when in the afternoon, and how often was the 3 times, and my confidence level was 8. And Lee, what was your action plan?
Well, my action plan, I will be in bed before 11:15, 3 days this last week, and it was a Monday, Wednesday, and Friday. My confidence level was 7, and I actually accomplished that, and I added an extra day, and I feel really good, and I actually feel rested. And I was in bed one night I was in bed at 10:30, so I feel good about that. Okay, so who would like to share their action plan first? Tom.
So I plan to walk 45 minutes about 3 times a week. I really felt very, very good about it. It was good for me.
My action plan was to work on organizing my suite. I'm going to have it redone, and so I would like to organize that. So organizing was what I did, and I thought I would do it for about an hour, and I will do it in the morning. That's when I have the most energy, and I will do it 4 times a week. And my confidence level was an 7.
I decided that I really have to lose some weight, so I'm going to cut back on snacks. Not going to have anything after about 7 o'clock at night. And my confidence level on that was about 7, and it worked. I'm really pleased about that. It worked well.
Lee and I have been leaders for 15 years, and we both took a 4-day training, a workshop, and we always lead it in pairs. And Lee and I both have chronic health conditions, lots of chronic health conditions between the two of us, and it's a great experience.
We follow a leader's manual, and so we have a manual to follow. We follow the book, and every participant in the class receives a book. It's Healthy Living with a Chronic Condition.
This is a chart you're going to see quite often, and we call it the symptom cycle. The important thing to realize is that there's lots of different symptoms that we all experience, and they can actually, one type of symptom can lead to another. For instance, anger and frustration can cause you to become depressed, and when you're depressed, you become very tired. And sometimes the disease itself can lead to tense muscles, and just having a disease can give us stress and anxiety. So the important thing about knowing that all these symptoms can lead to each other is that if there's some way for us to break the cycle somewhere along the line, then we can help our symptoms to improve, or we can look at them in different ways.
As Phyllis was saying, each one of these symptoms can lead to another symptom. In this course, we learn techniques to deal with each of these things and to break the symptom cycle in any of these places. So this vicious cycle keeps on going around and around, or in different directions, and we need to break it in order to heal.
So many things that we learn to deal with in this course. Things like fatigue, Negative emotions, when you've got a chronic illness, you have a lot of negative emotions. And one of the other things is dealing with your doctor. I mean, that's really important, how to actually talk to your doctor and get your information to the doctor. I think my personal favorite of all the techniques and all the things that we've learned was the action plan. I can decide what it is I need to change about my lifestyle to feel better, and if I've got an action plan, it's going to work better than just sort of struggling with it. As far as the action plans are concerned, I've got goals in my life, big goals that I want to accomplish. But it's difficult to do it all at once, so I've learned in the class to break it down into little steps, little things that I can do. And with the help of the class, it's much easier to accomplish. And probably my second favorite skill that I've learned from this whole program, you face one big problem and you take it in little steps. And that way you're able to accomplish it much more easily. And that gives you confidence to go on with the next problem in your life. And it's not just with your pain management or your chronic disease management, it affects the whole of your lifestyle. It's just a process we learn, simple little steps. You know how to deal with things.
And you know, once you have one chronic illness, you always get other conditions that come along, and you recognize that symptom cycle.
Yeah,
And each time you go through things, you learn how to break it. But not only that, you learn how to recognize it, and you learn how to accept your next chronic condition.
The things that I enjoy about the class is the bonding that takes place. After 2 or 3 sessions, often people who've been very isolated have suddenly found a friend.
When we looked at the symptom cycle before, one of the items that we talked about that many of us have is depression. And of course, we talked about the fact that depression can lead to other symptoms on the symptom cycle. So we're going to do some discussion and some talk about depression now. What we're going to do now is a brainstorm on what are the symptoms of depression.
Crying is one of the symptoms.
Lethargy is a symptom of depression.
Can't cope anymore.
When I'm depressed, my appetite goes, it's just gone.
Okay, so when I was first diagnosed with a chronic condition, I was going through a grief process, and that grief process, there was a lot of loss. Everything was just mixed up, and it was just like a great big collage of mumble jumble, and I knew I did things I ought not to do. So by taking this class, I realized that there were pieces, and this collage turned into a puzzle, and all the pieces fit. And taking part in the class, I was able to sort of help deal with some of these problems that I was having, and sort of take control of my life and deal with some of the issues.
When I was first diagnosed with my chronic health conditions, I had a lot of things going on in my mind, a lot of feelings and emotions and frustrations, and it was very jumbled. It was kind of like, if you would imagine a collage, a very messy, jumbled up collage. And in taking the course, I found that I attained a lot of skills that gave me the confidence to be able to do things that I wasn't able to do before. And so all of that confusion more or less gelled into almost like a puzzle piece where all the pieces fit together. And so then I had a picture of what I needed to do to help myself. And it really gave me a lot of control back in my life. The biggest change was giving me confidence again, and because I'd really lost my confidence because I couldn't do things. So I learned different ways of doing things in different, perhaps slower, or by asking for help that I wasn't doing before. So that helped me get the confidence back to try things again.
My chronic illness came about somewhat more quickly than most, I think, and involved a heart condition. And I found myself very fearful, terribly so, and upset and worried, all of the things that go with the unknown. And I did lose control of my whole health situation until my physician helped me to focus and bring back some sense of control. I then took this course, and that gave me the confidence, the sharing with others of a similar kind of illness, and being able to express and talk about it.
My doctor actually, honestly and truly, asked me about the program after a while. She said, "What are you doing that's different? You seem to have more control again." And I was just so pleased, because that's what it was all about. The program had given me back a feeling of being an individual, not just a patient.
Now, you saw an example of us actually using the problem solving when we were talking about our action plans, but let's actually go over the problem solving steps, because for sure, this is one of the most important steps in the entire program is problem solving. And the very hardest part of this is identifying the problem.
Before I retired, I was a prof at UBC in the School of Nursing. And so everything we do at university, you really look whether it's based on research. And because we found that the number of emergency admissions, visits to doctors, visits to hospital has come down. So it saves the province money.
To find out more about the Chronic Disease Self-Management Program and where it's been offered, you can either call the toll-free number or go to the website. The toll-free number is 1-866-902-3767, and the website address is